I stopped with the sugar within 2 or 3 weeks.
What will be the role of a caloric restriction?
I picked up the substance. I started to eat the way that I did before. The way that I eat food is the way that an addict is using their drug. I can't finish my work until I have a snack. I just call that a low-carb, like therapeutic low-carb diet.
How would you identify I'm a food addicted?
Imagine a woman looking at herself in the mirror and believing something she has quietly accepted for years, that this is permanent. The weight has increased over time, slowly, quietly, relentlessly. And somewhere along the way, hope starts to fade. She tells herself she will never be slim again, that this is just how life is now. She begins a journey she once believed was no longer possible. And over time, the impossible happens. She loses nearly 100 pounds. But that's not the remarkable part. The remarkable part is that more than a decade later, she has kept it off. 12 years later. No dramatic surgery, no secret supplement. So what did she discover that millions of people struggling with weight have not? Because science tells us that long-term weight loss is incredibly difficult. Research published in the American Journal of Clinical Nutrition found that most individuals who lose significant weight eventually regain a substantial portion of it over time. At the same time, obesity rates continue to rise worldwide, affecting more than 1 billion people globally, according to the World Health Organization. So, why do some people feel completely powerless around certain foods? Why can someone stop after 1 cookie while another person cannot stop after 10? The story doesn't end with weight loss. In many ways, that's where it begins. Because that woman went on to become one of the world's leading voices on food addiction and medical director of one of North America's leading addiction treatment centers. And today, she joins us to help answer these big questions.
Welcome to another episode of Khan Klinics. I'm your host, Dr. Amir Khan. Today, our distinguished guest is going to be talking about food and food addiction. Dr. Vera Tarman is a Canadian physician, internationally recognized expert in food addiction, author, speaker, and educator. She's the medical director of Renaissance, one of the largest treatment centers for substance abuse, where she has treated over 10,000 patients. She is the author of the widely recognized books, Food Junkies, The Truth About Food Addiction, and Food Junkies, Recovery from Addiction. These are standard texts that are used in school, food addiction programs, and other various courses around the world. Dr. Tarman, welcome to Khan Klinics.
Thank you very much for asking me to come.
Dr. Tarman, let's start with your personal history first. Your story goes back where you end up losing 100 pounds. You maintain that weight for now a decade. What do you believe was the biggest factor for you to get inspired, make that decision, and then get other people on board to follow your suit?
It's an interesting question to ask now, because when you hear somebody losing 100 pounds in today, 2026, the GLP-1s have made that not normal, but so much more normal than it was even 3 or 4 years or 5 years ago. When I started on my journey, I was in my 20s and 30s, and my experience was a gradual progression of weight, but mainly really a struggle around eating food. I, at that point when I was younger, said I must have an eating disorder and kind of lived with that understanding. When I got into addictions, I'm an addiction specialist. I started to see that behaviors as being very similar to the people that I was seeing for drugs and alcohol. And this was also before social media. And I couldn't read about this, other people having the same experience. So not that long ago, by Nora Volkov talking about food as an addiction. And that just made me feel like, well, I have my own experience and now there's science. And so I kind of got on a campaign to tell other clinicians and educate.
Excellent. Thank you for telling us. And tell us about your journey. How long did it take to lose 100 pounds?
Yeah.
What changes did you make? How did the diet play a factor? We know that this is not the GLP medication era, so you couldn't use medications. It's more about how you're going to inspire yourself. Exactly. We want to hear how you did it so we can inspire other people.
Yes. So what happened is I made this connection. That the way that I eat food, it's not healthy food, junk food and chocolates and candies and chips and cakes. It is the way that an addict is using and using their drug. And I thought, well, I'm going to do an experiment where I'm going to stop not going on a diet and restricting everything because that's what I did before. And we all know that when you restrict everything and you go on a diet with low calorie diet, you just want to eat. You just binge. I was successful for maybe a few months and then I would go back and I would just gain back whatever weight I had lost. And that was a repetitive yo-yo experience of yo-yo dieting and off and on a diet. But this was different. This was, I'm not going to be hungry. I'm going to be choosing the foods that I eat. I knew that junk food was not healthy all along, but I didn't realize that I don't have to look at it as, is it junk food or not? It just doesn't have sugar in it. So I stopped with the sugar and I found to my surprise that within 2 or 3 weeks, like it only took that long, that relentless, constant, what we now call food noise, I then called the food chatter, the food debate, really got quiet. And I started to lose weight. And that just took a few weeks. So I thought, I'm onto something. This is great. And then I realized that, like we all do, okay, I've lost this weight. I feel better. Now maybe I can bring back, have a little bit. I'm now in control. So now I can control eating of these particular foods. And I found that the moment I picked up the substance, whatever it was, I started to eat the way that I did before. So there was something funny about you pick it up again and you want to eat again, which is very typical in addiction thinking. So I thought, well, this is an addiction because when I don't have it, I don't want it. But as soon as I have a little bit, I want a lot. And then I lost about, over the course of, I guess maybe 4 or 5 months, about 50 pounds.
This is a new era now. In the last 10 years, we've learned a lot about controlling our macros, focusing on protein diet. We've also learned why carbs control and insulin has played a significant role in weight loss and other weight management endeavors we do. And then keto diet. Tell us, what's your take on this and how does it or may affect people who have food addiction?
I think that's an interesting question because I believe that there's a parallel between a person who struggles with carbohydrates and a person who struggles with food addiction. So a keto diet or a therapeutic low-carb diet is actually a perfect food addiction plan because most of the foods that are removed in a keto diet are refined carbohydrates, which are the addictive qualities. So I think there's an actual parallel process. People who are diabetic, who have struggle with obesity, there's a higher rate of food addiction in those populations. So it just remains to find the mechanisms, the crossover mechanisms between both.
Excellent. So the carbohydrate part is the one that is swaying you to eat more, and your levels are fluctuating. They go up and down, and when they go down, there is a surge for you to eat more food. Would that be a fair statement?
That would be a fair statement, absolutely. We know, generally speaking, that eating more carbohydrates makes you hungry, and they also make you crave more. Like there's just a lot. It's possible to crave dairy. It's possible to crave nuts, like things that aren't carbohydrates. But carbohydrates contain the main bulk of addictive foods.
And thank you for explaining that, Dr. Tarman. Dr. Tarman, tell us then in that scenario, what will be the role of a caloric restriction? Would you tell your patients, or do you tell your patients to restrict the food? And if so, how do you do that? How do you accomplish that goal?
Actually, when a person reduces their carbohydrates, their diet naturally restricts anyway, because ultra processed foods with carbohydrates have tremendous amount of energy useless calories. Like they're like energy dense but not helpful. But I don't actually deliberately say you should cut down your calories. This is not a calorie focus. It just happens by accident or by it just happens. If I think that if a person restricts to the point of hunger, they put themselves in danger of an eating pathology of like binging and then purging or overeating. Like I don't think that's a good idea. But if they focus on reducing the carbohydrates and any of the addictive foods, by nature, it will just reduce the carbohydrates anyway.
Excellent. Thank you for explaining that, Dr. Tarman. Dr. Tarman, tell us in the era of GLP medications, they tend to make you eat less. Have you seen your patients on the medication being less now addicted to food?
Oh, absolutely. We know that the mechanisms of the GLP-1s, besides the fact that it makes a person insulin sensitive and delays gastric emptying, it also affects cravings, like cravings not only for food, but alcohol and other things. So it actually is a promising venue for addictions in general. So we know that is the case. But the other thing is GLP-1s, a person doesn't want to eat that much. And so they also seem to not want to eat junk food that much. And GLP-1s are actually a tremendous boost to a food addiction plan. My concern about them is that they're not the end story, but they are a good start, especially for somebody who's struggling.
How soon do you see in your patient population the effects of GLP medication and the food addiction going down? Like you just mentioned, that the craving for junk food goes down. That must be a very satisfactory result from the medication.
I mean, it's within days to weeks. Like it's a phenomenal shock. I mean, people will even say, I had no idea that I had that much food noise because now it's so quiet. So it's actually such a marked change that those of us in the field of food addiction, especially coaches and therapists, are kind of losing their patients because their patients are saying, I don't need you anymore because I've got the medication. And we're kind of like saying, well, we know with medications, there's always a honeymoon phase, and then there's the phase afterward, and use this as a bridge rather than as the answer. But to many people, it is an answer because it is such a phenomenal change.
But Dr. Tarman, a lot of people have been trying to lose weight and some, because of their lifestyles, they're busy. Some women with a lot of responsibilities, other men because of their work lifestyles. They've already tried that. So why would it be different, and why wait now?
It would be different because they haven't heard the message of food addiction. Like what generally people have been doing in the bariatric clinics and obesity weight loss places has been basically eat intelligently, but you can still eat addictive food. They don't call it addictive foods. They said you don't have to stop some foods that you like, you just have to eat them less. And that would be like telling the alcoholic, alcohol is a big problem for you, but if we can just get you to drink on the weekends when you're not working, it's not a problem. But the person, if you're eating foods that are addictive, it's not possible to do that.
I get your point, and I think it's very important that our viewers understand when you're on this journey of losing weight, we want to identify something along the pathway. Yes, your fat needs to come down. You're going to eat less. You're watching your weight. But remember, there is a term called food addiction. And that addiction may come back right when you come off the medications. And you have to control, identify that. And I think that's the strong message you're trying to give here.
That's the message.
Identify that you have to learn during that time, mentally prepare, train for food addiction, because you one day may come off these medications and you don't want to get back to those addictive habits, because once you start, you won't be able to stop. Dr. Tarman, give our audience a few tips, and important tips of what mental mindset changes should they start doing when they know. How would you identify I'm addictive?
Right. Well, I mean, the definition of how do I know that I'm a food addict, it fulfills the criteria of any addiction at all. Do I crave for something or think about it? A lot of mental real estate is on that subject. I can't finish my work until I have a snack or something like that. Like it becomes very, I guess, part of an emotional coping mechanism. That's the first thing. And then the other feature about addiction is that you can't control the use and you can't stop despite negative consequences. So there's a compulsivity that even into dangerous territory, you'll continue to use. That's the piece of addiction that a person has to ask themselves, am I eating this and I can truly stop at the end of a few bites of a piece of dessert, or do I want the whole thing and then my neighbors as well? So there's that sense of compulsivity. How do you need to change your life so that you can not expose yourself into danger? And the first thing I would say is don't be hungry. So that's why I would say the regular diet that we've been prescribed in the past, just cut back, go down to 1,000 calories a day or whatever it is. It isn't going to work because hunger will just make you want to crave food even more. You have to choose your foods. And so that would mean I'm going to choose if I'm going to eat carbohydrates, they're going to be unrefined and high in protein, high in fat for satiety, and as low carb as possible because carbs just make you want to eat. So it's a deliberate choice. And then if you're going to do that, a tool or a trick that's really important is we are human beings and our willpower is strong, but it has weak moments. You have to remove those foods from your house so that at 9 o'clock at night when you're tired, you don't just say, oh, I don't want to cook, I'll have the pizza instead, that it's already prepared for you because you prepared ahead of time, and you don't have pizza in the house in the first place. So you have to make changes like that.
So I think the message is you prepare your meals in advance, know what you're going to be eating, time your food, look at the quantity, and plan your day ahead. I think those are very valuable, brilliant tips. I'm going to go to the next question, Dr. Tarman, and that's about people who are a lot of times anxious, lonely, stressed, and more importantly, those who are depressed. Food addiction becomes an emotional thing for them. Tell us, why is it important in those patients to identify, and what should they do about food? Can they do anything?
Okay.
Besides taking the medications?
Right. So, I mean, what you've just described is somebody who's using food as a drug. They're depressed. They need to uplift themselves. They're anxious. They want to numb themselves from their anxiety. And in the same way that I would caution a person to not eat drink or smoke marijuana when they're feeling that way, I would say the same thing for food. Now, first of all, we're using the generic term of food. I mean specific foods. I don't mean food in general, because we can enjoy food. And we can even have a nice bowl of soup that is comforting, but nobody eats too much soup. Like it's when you're using something as a drug, it loses the foodness of it, and you're just chasing a feeling. And it's not good to use anything for that, including food. Food is very available. It's very acceptable as a drug, but even so, it is a drug, and let's not use it. So if I'm feeling anxious, it would be better to recognize I'm feeling anxiety. I'm going to put the food down, and what can I do to deal with the anxiety?
Thank you for explaining
That
that.
might mean medication, but it might also just mean calling somebody to say, can we talk? I'm feeling anxious.
Does pregnancy have any effect on food addiction? And especially women, and especially on women who are working, busy, stressed, and under a lot of pressure?
Well, definitely
Food,
hormones have an effect. And we know that. I mean, hormones have a powerful effect on appetite, the GLP-1s being an excellent example of that. But, every woman who has a period knows that there's a particular time in a period when they just go crazy for sugar. And pregnancy would be any different. Menopause is the same. People really struggle with carbohydrate cravings, particularly, which is the drug aspect of food. So yes, it does have an effect. And it's a time where a woman has to be more careful. I don't know, just have to be more careful, maybe avoid the carbohydrates at that time.
thank you for explaining that, Dr. Tarman. That's great. Thank you for explaining that. Dr. Tarman, the next section is a rapid fire session. I'll be asking you a question line, and your answer is sort of like a one-liner.
Okay.
All right, so let me just start. One food you completely would like to avoid?
Me personally, or in general?
For your patient.
For my patients, ice cream.
Excellent. Biggest misconception about food addiction?
That it means all food. It's just sugar. It's sugar. It's just refined carbs. It's not all food.
Excellent. Is sugar addictive? Yes or no?
Yes, it is addictive. That has been proven.
Most important habit for sustainable weight loss. The most important habit.
Preparing your food ahead of time. And can I say one more? Support. Getting support.
Getting support. Okay, well, thank you very much for those two. One book everyone should read when they're on this journey for weight loss.
Can I suggest my book?
Of course.
Food Junkies, Recovery from Food Addiction. But there's a lot of books that have come out in the last 5 years.
That one book is fine, and we're going to show that to our audience as well. One thing people can do today for a better sustainable health.
Throw out all the soda in their fridge, and maybe they're popping their soda and their dessert. Get it out of the house.
What if it's diet?
It's an acceptable.
No sugar.
It's an acceptable bridge.
Alternative.
Yeah.
Coffee or tea?
Decaf coffee.
And favorite healthy snack?
I really like it's a concoction, rice cauliflower with cinnamon.
Dr. Tarman, thank you very much for joining us today.
Thank you very much for asking.
Food addiction challenges one of the most common beliefs in health, that overeating is simply a matter of willpower. Today, conversation reminds us that our brains, our environment, our stress, and the food surrounding us every day all influence our relationship with food. Understanding that relationship may be the first step towards the lasting freedom from it. If you enjoyed this episode, subscribe to Khan Klinics, click the bell icon, and share this conversation with someone who may be struggling with food cravings, emotional eating, or weight management. This is Dr. Amir Khan signing off from Khan Klinics. Stay informed, stay empowered, and stay healthy. Thank you.